All right, so my name is Lauren, and my group consists of Nick and Amanda, and we are going to be presenting on why we support universal healthcare. So to start things off, what is our presentation going to consist of? So we are going to talk about what is universal healthcare. We'll talk about the debate between whether or not we should support universal healthcare, and then we are going to follow it up with our stance as to why we support universal healthcare. What is universal healthcare? So, universal healthcare is going to be a system that provides medical services to all people, and it's going to be paid through taxes. Um, Nearly 30 million people in the United States do not have health insurance. There are many reasons why people may not have health insurance, ranging from affordability, um, whether or not they have a job, whether or not they're in the age range to provide social services such as Medicare or Medicaid. It also impacts people differently. So, depending on where they reside, the states that they live in, the age of the people, as well as their race. The largest age group that has been impacted by the lack of healthcare is going to be those working adults. And the reason that is the largest age group is because oftentimes their insurance is tied to their jobs. So if they don't have a job or if they're in between jobs, they have lost their insurance. And again, they do not have the um, access to a social service such as Medicare or Medicaid. The United States is fundamentally a private healthcare system, so it is not a universal healthcare system at this time. However, there are many states and countries across the globe that do have a universal healthcare. Those are including Canada, the UK, France, and Germany. All right, so as previously mentioned, there are many reasons that Americans are uninsured. Most common is going to be that it is unaffordable. So 73.7% of adults said that they found health insurance to cost too much. They also may have been ineligible. So they had no health insurance because they're ineligible, and that is about 25% of adults. The last one's going to be the loss of employment. So, most often, as previously stated, healthcare is tied to our jobs. Next, I will pass this over to Nick, who's going to talk about the both sides of the argument as to why we should support or not support universal healthcare.
Thank you, Lauren. So for some of the debate side on the pros and cons of actual universal healthcare, so on the plus side, obviously it could save lives. Another huge thing for us is it would provide healthcare to those that cannot afford it or an eligible, like Lauren was talking about. That's one of the main driving factors of this, is that a lot of people are either ineligible or just cannot afford it because it is so expensive. And with that higher amount of people being able to afford it and or a higher amount of people, sorry, that are able to have it now, it would obviously save the lives of those who would otherwise not be able to have it. It would also lower the healthcare costs for everybody. So in having universal healthcare, the healthcare costs as they are now would see a significant drop in cost across the board. With no matter what, when you introduce something, there are going to be some cons to that. So the cons for universal healthcare is that it would put the U.S. itself into further debt because it's providing a service that is not there at the moment to a bunch of people who are not using the service or paying for the service right now. So lowering the health or the cost of healthcare and then providing it to more people, it would put us further into debt. However, in the long run, it would be worth it because we are saving lives. Could cause extreme wait times for doctors and services. This is similar to what happened during COVID, is if we don't have the infrastructure built up for the medical offices to have everybody kind of start to have healthcare and bring them into our offices. So we would definitely see an increase in wait time, but also probably see an increase in actual services, healthcare services across the board for different people. So there would have to be a raise in healthcare services as well. And it would also just raise everybody's taxes just because of the now higher cost that is being brought on to the country itself. Everybody would have to kind of contribute in that case. So in that case, it would raise everybody's taxes across the board. So overall, our stance, the main point of this is that we would provide universal health care for people who cannot afford it. It would also include those that are not eligible at the current state. So universal health care would allow everybody to be eligible and be able to afford it because of the lower cost, and it would be provided by the government. Providing people with the costs that they need without causing them to face a financial issue because of it is huge, because obviously everybody deserves to be healthy and happy, and this is one step closer to that. And it also has the potential to save the lives of many people that currently we are not, unfortunately, they just cannot afford the services, so they're not able to have it. And then our references for that is as listed here.